Good morning to our valued members, stakeholders, and friends. Welcome to our Louisiana Business Symposium, which is our kickoff event of the year, normally held in Baton Rouge. We miss seeing you all in person, but understand we have all faced the different impacts of COVID-19 in these challenging times. Our organization is no exception, but I'm extremely proud of our response and leadership in making sure we provided our business community with critical information regarding resources, tools, and the programming to help them navigate the unprecedented business environment and overcome barriers. HCCL remained engaged and worked closely with our elected officials throughout the state of Louisiana, and is proud to be a part of many of the committees formed to ensure the voice of the Hispanic community was being heard. Thank you, Governor Edwards, for including us in the great work of the Resilient Louisiana Commission. As if a historic worldwide pandemic was not enough, we had the duty and responsibility to educate the Hispanic community and encourage participation in the 2020 census and national election. This allowed for great collaborations with local Hispanic media and other coalitions. Our programming was very robust throughout the year, including community calls, workshops and seminars, and moving forward with all of our signature events in a virtual format successfully. This was no small task, given the circumstances and additional distractions and limitations. I would like to thank our investors and members for your support, which validates the important work and service we do. If ever there was a vital need for our organization, this is it. Our work is more relevant than ever, and we cannot do it without the great partnerships we have built and continue to establish. I am excited about 2021 and invite you to please stay in touch with us throughout our website, social media, and communications. Our goal is to diligently work to bridge gaps and build a more equitable community through technical assistance, networking, access to capital, procurement, workforce training, digital and financial literacy, and access to health care. The historical disparities experienced by our community have been significantly highlighted through COVID-19 and resulted in disproportionate impacts. I ask for your continued support and engagement to erase these barriers. And now, it is my pleasure to introduce the chair of our board of directors, Ms. Marta Castillo, for some remarks. Marta.
Thank you, Moira. Good morning to one and all that are virtually joining us today. My name is Marta Castillo, Chair of the Board of the Hispanic Chamber of Commerce of Louisiana, and it's a pleasure to welcome you all to the 2021 Louisiana Virtual Business Symposium. Before going into the event, the team of the Hispanic Chamber of Commerce appreciates your effort to be together virtually. We are delighted to welcome those of you who have been part of the Hispanic Chamber for quite some time, and to all of those who have joined us recently, we welcome you. We welcome also to our Louisiana Governor, the Honorable John Bell Edwards, our guest speakers, Joseph Cantor, Region 1 Director, Louisiana Department of Health, Michael Risk, Regional Director, Small Business Administration, our respected participants, directors, and all guests that are virtually joining us today. Many thanks to our event sponsors for making this symposium possible. Louisiana Economic Development, Small Business Administration, Jefferson Economic Development Commission, Delta Personnel, Television, Viva Nola, Folgers, and all our annual sponsors. I will kindly appreciate the contribution of all the people who have worked hard enough to make this event a success. Myra, for your leadership, Alba and other staff members that have been working a lot of their time on this, and it shows this successful and well-organized event. I want to thank the board members, the Hispanic Young Professional Committee, and our volunteers for their participation. We are here truly as one. We do our best when we do it all together. So this is a good first step in the right direction to force synergy between all of us for one goal, that is to promote implementation of our mission, and which is fostering the continued economic growth development and promotion of Hispanic business and their association in the state of Louisiana. With the global COVID-19 pandemic, we all experience an unprecedented situation, a virus that has put the world on pause. It has put into question how and where we're going from here. Everybody battled with the immediate needs on this public health crisis. We probably have not seen at all the direction of this pandemic in terms of socioeconomic repercussions or more. But unprecedented crises also present opportunities for transformation. We today have among us an amazing keynote speaker, our great governor, the Honorable John Bel Edwards, and two exceptional guest speakers who will guide us toward our goal more decisively and to open in front of us new horizons, influence priorities, development plans in the health, social, and economic sectors. Well, not taking much of the time and going into the program, I will now want to take I need to leave some time for Myra to take over introducing the keynote speaker and fill you in with the rest of the event of this symposium. Until we see each other in person, hopefully next year we will be in person. Stay safe, stay healthy, and please remember to mask on. Thank you.
Thank you, Marta. And now it's my distinct pleasure to once again introduce to you the Honorable John Bel Edwards, Governor of Louisiana. The son of a sheriff and charity hospital nurse, John Bel Edwards understood the importance of serving others from an early age. From his service as an active duty airborne ranger in the U.S. Army to his time in the Louisiana House of Representatives, Governor Edwards has always put people first. John Bel Edwards was born 7th out of 8 children to Sheriff Frank Jr. and Dora Jean Edwards. He grew up hunting and fishing in Amite, a rural town in Tangipahoa Parish. He and First Lady Donna Edwards began dating while students at Amite High School. After graduating top of his class, Governor Edwards attended the United States Military Academy at West Point. On January 11, 2016, John Bel Edwards was sworn in as the 56th governor of Louisiana. In his first official act, Governor Edwards signed and executed order to expand Medicaid coverage to 430,000 of the state's working poor. The decision to expand Medicaid cut Louisiana's uninsured rate from 24% to just 10%. Saving lives and improving the quality of life for citizens across the state. Governor Edwards considers this the easiest big decision he's had to make as governor. Upon taking the oath of office, Governor Edwards inherited the largest budget deficit in Louisiana's history, following years of budget mismanagement, which included cuts to higher education and vital state resources and services. In 2016, the state faced a $1 billion shortfall to close out the last quarter of the fiscal year. And in 2017, the state faced a $2 billion deficit in the governor's first full fiscal year. Governor Edwards and a bipartisan, bicameral group of lawmakers worked hard to stabilize the state budget through a balanced approach. On November 16, 2019, the people of Louisiana re-elected Governor Edwards to another 4-year term. On January 13, 2020, Governor Edwards was sworn into his second term as the 56th governor of Louisiana. Governor Edwards continued to do what the people sent him to Baton Rouge to do, put Louisiana first. Hundreds of thousands are insured. Louisiana's budget is stable, and Louisiana is open for business. And I know, Governor Edwards, I want to thank you personally for the great job during this very tough year that you've had to lead. Thank you again for making the time in your busy schedule to be with us once again. It's our pleasure to have you and to listen to your words. Thank you very much, Governor Edwards.
Myra, thank you so much. I appreciate you for all the work you do, and I thank you for that very gracious introduction. And thank Martha for her work as well. This is a little different format than I'm used to seeing, so I just want a thumbs up from you, Myra, if you could hear me right now. Okay, good deal. I appreciate everybody on this call for the work that you do in communities all across Louisiana every single day. It is incredibly important. And the virtual meeting right now, unfortunately, is the best that we can do and remain safe. I recall very vividly speaking to you all a year ago here in Baton Rouge at the Hilton, as I've done a number of times. But boy, the year that we've had since then has been tough. In fact, it seems like about 10 years worth of work crammed into one. And I know that's true for all of you all as well. We are just in a very different place than we were a year ago. It's been a challenge. Myra told you about the circumstances in the state of Louisiana when I became governor with respect to record budget deficits. And we had really clawed back, and we're in a great place. And at this time last year, we actually had the fourth fastest growing economy in the country when COVID hit and really caused problems across the country and here in Louisiana. But I want you to know that I remain very optimistic about our future. I believe that we will close out this year much better than it started, and it'll be a much better year overall than in 2020. And even saying that, I can tell you, and I'm going to give you some examples in just a moment. We had some very significant economic development wins, and we've made tremendous progress since the worst part of the pandemic with respect to its impact on the economy, at least to date. But obviously, COVID-19 has changed everything. After almost a year of intense efforts to overcome the disease as a state, we're right at 400,000 cases. And by the way, these are confirmed cases with tests. We know that up to 50% of all people who get COVID-19 are not symptomatic, and they don't necessarily take a test. But there have been at least 400,000 discrete individuals test positive. And so we know more than that have actually had the disease. We now have over 8,500 deaths. And I will tell you that currently there are more than 1,600 patients in our hospitals across Louisiana because of COVID-19. And that's severely testing our healthcare delivery system and challenging our ability to preserve the capacity that we need to provide life-saving care to people, not just because of COVID. You could be a car accident or a stroke or a heart attack, or you name it. If you need a hospital bed and staff to give you life-saving care, you've got to have that capacity there. And we're doing a little better than we were just a few weeks ago, because we got to almost 2,100 because of the Thanksgiving and Christmas and New Year's surge. It appears that we're flattening off now, but at a very, very high level. And we all need to be particularly concerned about that, especially as we discuss new variants of the virus, one from the UK, others from Brazil and South Africa, which seem to be more easily transmitted and also potentially more dangerous, although that's not yet as fully established. But it is more important than ever to protect ourselves and to protect our family, our friends, our neighbors, our coworkers and employees. If we want to be able to make it through this in the best possible shape and remain viable in terms of our businesses, we have to make sure that we are doing everything reasonable, I should say, to protect one another. And I think it was Martha who said it a while ago, and I'm going to talk about the vaccine in just a moment. And the vaccine is very promising. It is the way that we're going to end up putting this pandemic behind us is by getting enough people vaccinated. But that's going to take quite a while. It is true today that the single most important tool we have to protect our family, our friends, our coworkers, neighbors, known and unknown, is this mask. This is the single most important thing that we can do because the vaccine is not available for everybody today. We don't have the quantities necessary to get everybody vaccinated right away, and we're having to work through our priority groups. But this mask is available for everyone, and it does confer a benefit on the wearer as well, because the wearer of the mask is less likely to contract the disease also. You're going to be hearing from Dr. Joe Canner a little bit later this morning. He and his team at the Department of Health and the Office of Public Health are doing just tremendous work and have been for many, many months now. And they literally work around the clock 7 days a week as we continue to respond to the pandemic. And he's going to give you all lots of really good information. But I did want to discuss some of the ways that we're working to address health equity. You know, one of the biggest things we can do right now, besides wearing our mask and socially distancing, staying home when we're sick, washing our hands, is to get the vaccine when it's your turn, meaning when you're in the priority group. And I also need your help to make sure that people that you have influence with, and you have influence probably that you're unaware of, all over the state of Louisiana, and not just to the Hispanic community, but you have influence, period. This vaccine is safe and effective, and it's a Pfizer vaccine. It's a Moderna vaccine. I anticipate that Johnson & Johnson may come online next, and if it's granted an emergency use authorization, that will mean it's safe and effective as well. But we need your help promoting this because we know there's still vaccine hesitancy out there in certain groups. And it's less pronounced in the Hispanic community than it is in the African American community, but we know that there's still an awful lot of vaccine hesitancy in the Hispanic community as well. But back in April, I created the Health Equity Task Force to work with the Department of Health, the Office of Public Health, and critically important because we knew that the disease was having a disparate impact on minority communities. And what it did is it shined a bright light on the health outcomes in our state, which have been uneven for a very, very long time. And because of the prevalence of comorbid health conditions in certain parts of our state, driven by socioeconomic factors, which are particularly prevalent among African American communities and also the Hispanic community, we know that COVID-19 was causing deaths, for example, way beyond what would be expected. And quite frankly, Myra mentioned the Medicaid expansion. I am 100% convinced that had we not expanded Medicaid in 2016 and made primary care, preventative care, and prescription drugs available to about 400,000 more working poor in Louisiana, that the impact of COVID-19 would be even worse because we were able to get people healthier before the pandemic set in. But I am not in any way trying to tell you that because of Medicaid expansion, we didn't have problems. We did, just like the rest of the country. But now I want to make sure that we promote the safety and efficacy of the vaccine in an equitable way too. As we make sure that we are distributing and administering the vaccine in communities that are disadvantaged and hard to reach, much like we had to do through testing, where we had to actually send strike teams into certain zip codes in order to make sure there was enough testing available. We're going to make sure that we're doing everything that we can to distribute and administer vaccine in a way that is equitable as well. We know that we have to build trust in the vaccine in communities of color because there's a lot of distrust on vaccines in general, and this seems particularly true with respect to these vaccines for COVID-19. We also know from an earlier national survey that Latinx communities have a higher willingness than African American communities to take the vaccine, But as I mentioned, there's still issues that we have to overcome in both of these communities. The task force is supporting the Department of Health, the Office of Public Health, in its community engagement and communications campaign. We're standing up 4 vaccine advisory councils to take the lead in community engagement. The advisory councils are established by sector. One of those sectors is healthcare. Another is the faith-based community. Then we have the public sector and we have the community sector. And I understand that the Office of Public Health has reached out to your organization to participate in the Community Sector Advisory Council. And I want to encourage you to participate. You are a critical part of what we're trying to do if we're going to be successful. So please participate, help as you can. In the spring, the task force is going to be reaching out as they continue to work with the Department of Health to unveil a new health assessment dashboard and begin the community engagement process in an effort to ensure that my weekly COVID press conferences reach more people. We've been recording a Spanish language interpretation that can be accessed through my YouTube page, which is under the username Louisiana Gov. At the same time, we've been battling the public health aspects of COVID-19. We've obviously been working overtime to learn how to conduct business in these unusual circumstances. You know, how do you keep your doors open? How do you keep your customers safe? Because if they don't feel safe, they're not coming in. How do you keep your workers safe and maintain an efficient business when maybe you're having to do a lot more work from home and those sorts of things? How do you balance a budget with the changing business conditions that we're seeing? We're doing the same things at state government. And I know and it's a challenging for us, and I know it has to be challenging for you because, quite frankly, I have more assets at my disposal than you do probably. Our Commissioner, Jay Darden, can attest to what a steep challenge this has been for the state of Louisiana. And so I know that your individual businesses, without all the resources that we have been challenged too. And that's why we worked at every turn to locate and deploy financial assistance that can help Louisiana's small businesses. We're grateful that the Louisiana small businesses were able to capture over $7 billion in Paycheck Protection Program assistance through the CARES Act last year. We're hopeful that Congress can successfully pass an additional COVID-19 stimulus package that President Biden has outlined with $440 billion allotted for small businesses and communities across the country. And I know the details are still being hammered out in the negotiations, but hopefully that will happen, and it could come as soon as February, although some people think March is more likely. And then it wasn't just the pandemic this year that have impacted us. Louisiana was struck by 3 separate hurricanes, including the strongest hurricane to hit Louisiana since at least 1856, Hurricane Laura that hit in late August down in southwest Louisiana. And a couple of months later, Hurricane Delta hit in that same area. I think it was about 10 miles away on the coast where it made landfall. More than 80% of all damage in the United States in 2020 from Atlantic hurricanes happened in Louisiana. So I'll say that again. More than 80% of all the damage in the country from hurricanes in the Atlantic for last year happened in Louisiana. And as a result, more than $800 million in hurricane assistance has come to us from FEMA and the U.S. Small Business Administration. And obviously the bulk of that is associated with Hurricane Laura, which had its biggest impact in southwest Louisiana. But for the first time in history, we had a storm that was still at hurricane strength as far north as Monroe, Louisiana. That's never happened before. And we're very much in active assistance mode with Hurricane Zeta that actually hit in New Orleans later in the year, and not just New Orleans, but in southeast Louisiana. And if you sustain physical property damage from Zeta, I want to remind you that the deadline to apply to the Small Business Administration for assistance from them is March the 1st, while the deadline for economic injury applications is October the 1st. And Michael Ricks is one of your other speakers you're going to have today. I know that as a Louisiana District Director for the Small Business Administration, he's going to give you a lot more information on this, but please take advantage of whatever assistance out there that you need. So from COVID-19 to hurricanes, 2020 taught us the importance of disaster response, recovery, and preparation as well. And that's why in April, I created the Resilient Louisiana Commission. And by May, they reported to me on recommendations for safely reopening the economy. 15 individual task forces focusing on every single aspect of our economy. And then in November, they completed a report of long-term recommendations called a Comprehensive Game Plan for a More Resilient Louisiana. This commission, chaired by LED Secretary Don Pearson and the healthcare executive Terry Sterling, drew from the expertise of over 300 citizen leaders to compile this new game plan. And this is why it's important. The Resilient Louisiana Commission looked at every single facet of life in our state, every sector of our economy, and they recommended key steps for making our state more resilient. Things like investing more in early childhood education, building a better and safer infrastructure of highways and bridges, expanding access to quality health care and broadband internet to everyone in Louisiana, making sure our small businesses have access to capital, and so many other things that they've reported on. And I know some of you contributed to this game plan, so I thank you very much for that. I encourage all of you to go to opportunitylouisiana.com/resilient Louisiana to learn more about these priorities and these recommendations. Again, that's opportunitylouisiana.com/resilient Louisiana. And please work with our administration and the legislature to help us accomplish these priority steps. You know, we wanted to compile a report and with key recommendations that would help us move into the future. Obviously, we have to enact those recommendations. Many of them require legislation. So we ask you to please be involved in the legislative session that starts in April. It's a 60-day session this year. It's called the fiscal session, and we're going to be working hard to make sure that we are advancing those priorities through the legislature. I also want to tell you a little bit about our economy. Obviously, very challenged. You know, at the deepest part of the downturn last spring, the decline in employment in Louisiana was right at 300,000 jobs. Think about that. In the state of Louisiana, 300,000 jobs were lost. By the end of the year, we had recaptured all but about 90,000 of those jobs, and we continue to make headway. But we have a lot of our brothers and sisters who are not working, or maybe they're working for a lower wage or fewer hours. And there are so many challenges that continue to face them and our businesses, our families, our state as a whole. But I will tell you, I've been impressed by the resilience of our small businesses in Louisiana throughout this year of crisis. It has been a challenging year to deliver the services necessary. So, for example, we've never had as many people filing for unemployment assistance as we had this past year. And brand new programs for assistance were created by Congress to include self-employed gig workers and so forth that never was part of our process before. And while, like every state, we were slower than we wanted to be in processing and administering those claims, I can tell you that recently the U.S. Department of Labor, it was one of the last things that they did under the Trump administration, recognized Louisiana as being #1 in the country for the timely processing and payment of unemployment claims. We're not satisfied. We know that we still have to do better, but I think you can just imagine how difficult this was to administer so many different and new programs all at the same time for so many different people who were applying for this assistance. We also last year, despite everything that was going on, we secured 58 major project wins for the state of Louisiana, totaling more than $12.7 billion in new capital investment for the state. They're going to retain more than 8,600 existing jobs across our state, and they're going to result in more than 11,600 new jobs in leading industries. And in fact, we had the second biggest economic development deal in the nation with Growing Fuels at the port of Greater Baton Rouge. This is a project to create a refinery to produce diesel from renewable sources such as soybean and corn. And number two project in the country last year. And we still have a lot more work to do, but I want you to know that I'm optimistic about our future. I want you to be optimistic about our future. And while we have light at the end of the tunnel from the pandemic because of the vaccine and the vaccinations, we've got work to do between now and then to reduce transmission. Our percent positivity, meaning the percentage of tests that we're administering on a daily basis, remains far too high. It exceeds 10% when the goal is no more than 5%. New cases remain high. Every single parish, all 64 parishes, have a high incidence for new cases of COVID per the CDC, with more than 100 per 100,000 over a 7-week period. That's all 64 parishes. We still have too many people in the hospital, and unfortunately, we have far too many people who are dying of COVID-19 every single day. So we still have a lot of work to do. I'm going to ask for your help, your continued partnership. Let's put our mask on. Let's social distance. Let's wash our hands. Stay home when we're sick, and make sure you give your employers the opportunity to do these things, please. It's so critically important. And then let's get the vaccine when we're able to do so. And between now and then, let's promote the safety and efficacy of the vaccine to overcome the hesitancy. Because quite simply put, the only way we put this pandemic behind us is when a big enough percentage of the people in our state and in the country, and quite frankly in the world, but we can only do our part. But a big enough percentage has to actually be vaccinated. We're going to keep working very hard to improve our efficiency, the utilization of vaccine, depending on the day and the source. We rank somewhere between about 6 in the country to 12 in the country in terms of vaccine utilization. Again, we're not satisfied with that. We're going to keep getting better. And we got some positive news out of the White House yesterday that our vaccine allocation is going to increase by 16%. And they're going to give us 3 weeks of stability on our allocations so that we have a longer time to plan. Believe it or not, up until now, we find out our final allocation on a Thursday. And then we had to put in our orders for a vaccine that was going to be delivered the following Monday, and do all of our communication with our partners who are going to be receiving and administering these vaccines. That's very, very difficult, especially for a state like ours, where we chose to engage multiple partners throughout the community. So we have 324 enrolled providers this week who are administering vaccines in all 64 parishes of our state, with a strong emphasis on equity. But having 3 weeks notice is going to give us much more time to refine our plans, communicate them, and make sure that our partners are fully prepared, and that they're not scheduling more appointments than they're going to be able to keep. So we're doing relatively well, but nobody's going to tell you that we're satisfied. We still need more vaccine as soon as we're able to get it. And I need your help in promoting the vaccine in terms of its safety and efficacy. So thank you so much for your diligence and working hard, for staying safe until that day comes. Please communicate with me or LED, anything, or the Department of Health, whatever you all might need for assistance, because we're in this together, and we're in it to win. So God bless you. Thank you so much. I wish you nothing but the best of success throughout 2021. And Myra, thank you for your personal work and leadership at the Hispanic Chamber of Commerce of Louisiana.
Thank you, Governor Edwards, and God bless you. I know it's been a very tough year, but you've done a great job, and we're very proud of it. I have my mask, and we continue to work very, very hard to disseminate that information. Count on us as a partner to continue helping and to help with the vaccine. Also, all the information that needs to go through the community, we're here. Standing tall to be side by side with your administration and continue working in every aspect. I do have a couple questions for you from the audience, if you'd like to take
Okay. I think I can do that.
Okay, so one is, last year, the governor stated that procurement with minority businesses would be increased. A year later, can we see any data? What about a subcontracting program like other states and the federal government have done? And I know it was not a typical year, so we can only go by what we were able to do. But I know that's one area that you take very seriously and you've been working on.
Yeah, we have. And in fact, I apologize. I don't have the numbers, but I received a briefing, for example, from Sean Wilson, Dr. Wilson, who is the Secretary of the Department of Transportation and Development. And I know that just at his agency alone, there was a very significant increase in the number and the dollar amount of contracts that were awarded to minority businesses from here in Louisiana. And I can assure you that every time we have significant procurements coming up, I am revisiting this issue with agencies all across the state to make sure that where we possibly can, we're awarding contracts or subcontracts to minority business enterprises and those that have been disadvantaged. And so we continue to work on that. Myra, between Sean and Mandy Mitchell at LED, I can get you more specific information. Quite frankly, I didn't prepare for this particular a presentation like I have in the past because of all the other things going on, especially around the vaccine. And I was in Lake Charles yesterday doing hurricane recovery meetings. But I can tell you we are doing better, and I'm going to get you the numbers, how we quantify that, so that you can share that with your members.
Well, Governor, I understand. Again, we thank you for taking the time because I know those are priorities and you're everywhere all the time. So thank you again. And we look forward to 2022 where we can shake your hand and give you in person, take pictures and all the fun things we do when we have our event in Baton Rouge. Thank you again.
Yes,
have
ma'am.
a great day. And again, we're here for you. Don't hesitate to contact us any way we can help with this process, and we will recover. We're doing it together. That is the bright side, has brought
Yes,
our
ma'am.
communities together. So thank you.
Thank you so much, Myra. God bless you and everyone.
Thank you. Thank you. And now it is my pleasure to introduce our board member, Ms. Alejandra Castillo, who will introduce our next speaker. Alejandra?
Hi, good morning, everyone. It is a pleasure to be here with you. And it is my biggest honor to introduce my friend and colleague, Dr. Joe Cantor. Dr. Joe Cantor is the lead public health official for the Greater New Orleans area, where he coordinates clinical services, emergency preparedness, infectious disease control, and strategic health initiatives for the region. As Director of Health for the City of New Orleans, Joe led Mayor Mitch Landrieu's comprehensive opioid mitigation strategy, equipping the City of New Orleans Police Department with the reversal medication, increasing availability of medication-assisted treatment, and promoting harm reduction services. Also, he initiated a citywide effort to reduce the stigma of addictive disorders. Dr. Cantor, as I said, it is an absolute pleasure to have you here today and hear from you and your presentation. So welcome and thank you for being here today.
Thank you so much, Alejandra. It's really nice to be here. Alejandra and I met each other at the leadership program a couple years back, and it's been a real pleasure. And Myra, thank you so much for putting this on. And thank everyone for joining and for the honor of being able to address you for a few minutes. I serve currently as the state health officer for the Louisiana Department of Health, and I help oversee the response to the coronavirus pandemic. I'll tell you first, I have the most appreciation and thanks for Governor Edwards. He's been a great leader to work for. He understands the dynamics of this pandemic better than any elected official out there, and I mean that in all sincerity. And so I thank him for his leadership on this, and I also thank him for conveying a message of optimism, because I'm optimistic. This has been just the most challenging of year, but finally we have light at the end of the tunnel. Having the vaccine, and not any vaccine, the vaccines we have, the Pfizer vaccine and the AstraZeneca vaccines are, in terms of vaccines, they're home runs. They're highly efficacious vaccines, very safe vaccines, better than a lot of other vaccines that are out there for other that we take all the time. This is, as the governor said, how we get out of the pandemic. There's no question about that. We just have to work hard until there's enough vaccine out there for everyone. It's going to take some time to build up herd immunity on it, but to have an off ramp, so to say, to be able to visualize what it looks like. I really feel like we've turned the corner. And now every day that goes by, every time we see the number of people that got vaccinated go up a little bit, and it's going up a little bit every, that's one step closer and one step closer to putting this pandemic behind us. So that's what I'm optimistic for. I hope you share that optimism with me. I'll give a quick update about where we're in terms of COVID in general, and then talk about the vaccine more specifically. As the governor mentioned, it's been a go with COVID here, and it is not lost on anyone in the Department of Health that the COVID pandemic has hit Hispanic communities in Louisiana particularly. A lot of members of the Hispanic community have employment that puts them on the front lines, increased exposure, and that really takes a toll. So one of the big goals of ours in the Department of Health has been to approach our response with appreciation for equity and a real desire to ensure that the folks who are most at risk have equitable access to testing, to mitigation strategies, and now vaccine. We're just now coming out of our third spike. So our first spike in Louisiana was late March, early April. It was one of the first spikes in the country, very early on, and it really was focused in the greater New Orleans area. At that point in time, it feels like it was 20 years ago right now, but I'll take folks back. There were 2 weeks in March when cases were growing, where we had the fastest growing outbreak to date in the world. At that point, faster than Italy, faster than South Korea, and faster than Wuhan, China. The community came together quite well and turned that initial spike around, bent the curve, and I think saved a lot of lives in the process, although we did suffer more fatalities than we had wished. We went down, and we went back up in cases in late July, August for our second spike, and that really was a statewide spike. Every parish of the state, every hospital in the state was quite busy. And it coincided with spikes in a number of neighboring states, Texas, Arizona, Georgia, Florida. We recovered from that spike, and then about 2 months ago, we started increasing what became our third spike. And that peaked right around Christmas and New Year's time. We know a lot of people traveled or hung out with family, even though it wasn't the most advisable thing to do. We were not naive in knowing that happened. And that really did fuel this third spike and Thanksgiving holiday as well. As the governor has mentioned, we now believe that we're coming down a little bit from that third spike. And it's good news on one hand. We're thankful that we're going in the right direction. But we're still awfully high in terms of our cases and the risk that's out there. So we update our numbers publicly every Wednesday around noontime. And what will be announced today at noon is our percent positivity has gone down a little bit to 8.6%, which is a little bit lower than it was last week when it was just 10.3%, but still way too high. And it's still a very, very high number. The point being, there's just a lot of risk out there. And there's just a ton, to be frank, of COVID circulating in the community. And if you talk to people, what a lot of people are saying is they've never known people that are sick with COVID than they do right now. And that plays out in the numbers. Every day, we have the dishonor of announcing anywhere from 40 to 80 new deaths being reported. That's what our average has been going back about 5 weeks. That's really unacceptable. Deaths, we know, are a lagging measure. It takes time for that data to come to us a little bit. And so by the time we report it, it's already happened, and the die is somewhat been cast for that. We owe it to our neighbors and family, I think, to do better. The reason I'm saying this is because we still have a lot of risk ahead of us. Even though we appear to be coming down from this spike, we're still very, very high. A lot of COVID out there. And looking ahead, we have the new variants that the governor mentioned. Right now, particularly the one that's come in from the United Kingdom. The technical name for it is the B.1.1.7 variant. And viruses, particularly coronavirus, they mutate all the time, in tiny, usually insignificant ways. Every now and then you have a mutation that actually does change the dynamics of the virus, and that's what happened here. So we're still learning about the new variant. There's still things that we'll discover about it. What we know so far is it's almost certainly more transmissible. It's easier to be spread from one person to another. We think up to about 50% more transmissible. There's a growing body of evidence to suggest that it might be more dangerous, might be more virulent, might make people sicker. Not by a magnitude, but by some. We initially did not think that was the case, but there's some reports coming out of the UK now that perhaps it is the case, and that's concerning, no question. We don't think that there's any problems with the vaccine in the new variant. We believe the two vaccines we have now, the Pfizer vaccine and the Moderna vaccine, we think both are a good match for the variant, and that's good news. We don't know yet about some of the other variants that are out there, just not in higher numbers, but particularly the South African variant. But for the UK variant, we think the vaccines are a good match, and that's really good. We have one confirmed case of the variant in Louisiana. I promise you we have many more that we just don't know about. This country does not do a whole lot of genomic sequencing. We don't sequence a lot of the coronavirus that the country gets. European countries tend to do a lot more. So when you have one identified case like we do, and this was identified in the greater New Orleans area, you're almost certain to have many, many others that you just haven't identified. In fact, almost every day we're sending samples up to the CDC to be tested and confirmed. So in the very near future, without question, you will hear that other cases have been identified in the state. It's just the tip of the iceberg. There's a lot more. The CDC says that by mid-March, this UK variant will likely become the dominant variant in the US. What that means for us is we probably have another surge coming down. It's probably going to drive up transmission. Cases are going to go back up. So I think we do need to be prepared for that. As the governor mentioned, right, the vaccine is, think of it as a medium and a long-term strategy. It's not a short-term strategy. It's just not enough vaccine to make it a practical short-term strategy. The short-term strategy is the mitigation measures. It's distancing, it's masking, it's staying outside whenever you can, it's avoiding gatherings if you can do that, it's staying to your household pod whenever you can. That's the only short-term strategy we have. And the more that we can do that, the more lives that will short-term. It really is as simple as that. There's another that we kind of added to the arsenal. I think I wanted to let folks know about, and this is a exposure notification app that download onto their phone to help them be aware, be notified if they come in contact with someone who is positive for coronavirus. It's called COVID Defense. I'll show you what it looks like in a second. It's completely free. It's completely confidential. And more importantly, it's 100% voluntary. So this is what the app looks like. And I've done it with mine last week. The way it works is Bluetooth to cast a radius, a 6-foot radius around the phone. And with me having the app, if I were to come in contact with someone who also had the app and was found to be positive, I would get an anonymous notification a little later that night on my phone that I came in contact with somebody who was positive. I won't know who it is. It's all anonymous. It doesn't track my location at all. All it does is cast a 6-foot radius around by Bluetooth and exchanges anonymous codes. The point of this is that when we still do a lot of contact tracing, but contact tracing has limitations, and you have to know someone personally. You have to know their phone number, and you have to be willing to share that with the contact tracers. This doesn't rely on any of that. So it's something you can do to kind of protect yourself, protect family. You'll get a notification if you do come in contact with someone who's positive, and that'll be a message to you to go get tested and take measures to protect your own family and your own contacts. So if anyone has not downloaded, we've had about 30,000 downloads so far in the first week, which is pretty encouraging. But it's called COVID Defense Louisiana. It's on the App Store for both on Android devices, completely free, completely confidential, and completely voluntary. You don't have to do it. But I think it'll be handy, particularly maybe in college settings and a lot of workplace settings where it's difficult to do other types of contact tracing. I think this app will be handy and make a difference. Let's talk a little bit more about the vaccine, because this is the really exciting stuff. So the two types of vaccine we have now, the Pfizer vaccine and the Moderna vaccine, we're just incredibly fortunate, because I'll tell you, a few months ago, we would have been happy with a vaccine that was 50 or 60% efficacious. That's actually more than the flu vaccine is. To have a vaccine, and these respectively are 95 and 94% efficacious, to have a vaccine that effective is just an absolute home run, and we have to take advantage of it. I can only think of one vaccine offhand that is more efficacious than 95%, and that's the measles vaccine that gets up to around 98%. But most vaccines are not that efficacious, around 90, 85 maybe, and they rely on herd immunity to protect everyone else that doesn't get the full coverage. These vaccines really are good. They're also very safe. The side effect profile for these vaccines is on par or better than any other vaccine that's out there. It's not going to feel that way in the media, because there's a lot of attention on this. And I think when people do have small side effects, it's going to get well covered in the media. But to just remind folks to take some perspective on that, and I'll tell you, my night job in ER, I still practice, and rarely do I ever work a shift and not treat someone for side effects of a medicine. I mean, just look at the medicine bottle that you have in your cabinet and read the fine print. So there's a lot of side effects out there. This vaccine is very, very safe. Don't let overblown reports in the media cloud your understanding of that. It's a very, very safe vaccine. It actually uses a new technology that does not rely on a live virus as the vaccine vehicle. So it's a very clean vaccine. It's a technology we've used for cancer therapeutics for a number of years now. And actually, for the viruses, it was started to be developed after the SARS pandemic. There was a lot of investment in a vaccine against, SARS was a coronavirus as well. And that's where it came from. And that's one of the reasons why this vaccine was able to be produced so quickly. It was built on a lot of technology that was already in development. The other reason why this vaccine was able to be produced so quickly is because the feds essentially placed a bet on it, and they paid the pharmaceutical manufacturers to start producing it at scale while the trials were still going on. And normally we would never do that, because if the trials weren't good, you would lose that money, it would be wasted. But it obviously was worth it in this case, and the bet, because the trials proved good, and now we had a head start on production. So that's one of the main reasons why we were able to get the vaccine out so quickly. To have a vaccine, it's 12 months ago, we barely even knew the virus existed. And to have a vaccine now, not only identified in the lab, but actually being given out in the community is pretty remarkable. That's how that was possible, not by skipping any safety steps. And that's important to mention. There were no safety steps skipped. The feds just paid for it to be produced while it was being studied in the hope that it would prove to be good, which it was. As the governor mentioned, we have elected to take a broad and wide distribution strategy for this vaccine. It's interesting. Every state's done things a little bit different, but there hasn't been a lot of supply to go around. So what we have chosen in Louisiana, as opposed to running some big, a few big vaccine sites in big cities, like in the Cajun Dome and the Superdome and so forth, we spread it out to everyone in the state. So we are pushing vaccine to a broad network of providers. These are hospitals, clinics, pharmacies, and for pharmacies, both big chain pharmacies like Walgreens and Albertsons and so forth, and small independent pharmacies, all of it. we have about 1,800 providers, vaccine providers enrolled in the state. And that was a very big lift to get there. Now, there's not enough vaccine for them all to have it and to distribute it yet, but there will be. And when we get more supply, we'll be able to activate this very broad network. So currently we have vaccine in all 64 parishes, and we're working hard as we identify localities or communities that are not well served to find ways to direct vaccine to them. And we have a few ways we can do that. We can add a new vaccine provider, bring a new clinic or pharmacy online that's in that area or serves that population. We can also direct team to that area to do an on-site event. And that's what we'll continue to do as we identify communities or localities in the state that have yet to be well served by the very limited vaccine supply. We will get to more eligibility tiers. We will get to, for example, essential frontline workers and teachers and people who are 65 years of age and older and people with preconditions. We will get there. We're just not there yet. There's still very long wait lines, and we don't want to extend eligibility on paper but not have it play out in actual access. Once we get more supply, that's when those type of eligibility will be extended. Right now, we're still very limited, but we're doing pretty well. Governor said we're usually ranked in by the top 20% of states in terms of how much we administer versus how much we get. We just want to get more. That's been our main ask to the feds is however much vaccine they can give us, we will administer it out quickly. That's what we've done so far. It's been a big effort of ours to reduce barriers to vaccine access where they appear. So certainly if there are communities or localities that have not been well served, that's something we want to know about so we can help direct resources to those areas. We've worked hard to reduce the barriers on the vaccine sites at the point of provider or point of sale, so to say, for people that don't have identification on them or don't have a social security number. Folks can self-attest. There's no strict requirement. Payment is not a barrier to the vaccine. There should be no cost to a patient to receive the vaccine. The vaccine itself, the actual medicine, is paid for by the feds. The administration of the medicine, there's a small fee that a provider can get reimbursed for. It's about $43 for the 2-dose series. So a provider can bill a patient's insurance if they have insurance. If the individual is uninsured or underinsured, there's a mechanism for the provider to recoup that administration fee from the feds directly. But no one can be barred access to vaccine for lack of insurance, period. No one can be asked to pay out of pocket to receive the vaccine. We feel very strongly about that. We've communicated that to our vaccine providers. And if we get word that that's not taking place, we'll investigate that aggressively. We've also communicated very strongly to our vaccine providers that there can be no discrimination. When somebody signs up to be a vaccine provider, they're signing up to give out the vaccine on a first come, first served basis to anybody in the community who's eligible. Not just people who have a pre-existing relationship with that provider, not just their agents, not family and friends, anybody. And if we do hear about any discrimination, we also will investigate that aggressively. We feel very strongly about that. The last thing I'll mention is community engagement and promotion. Right now, the supply of vaccine is so limited that the demand just clearly outstrips supply. But hopefully, in the near future, 3 or 4 weeks, that won't be the case, and we'll have more supply coming to us. We're going to work hard to build up a vaccine promotion and education campaign until we get to that point. There's a lot of myths out there about the vaccine, and we want to dispel those myths now before our supply increases. Some of those myths are that safety steps were skipped in the development of these vaccines, and that's not true at all. Another myth is that it is somehow dangerous to women of childbirthing age or might make them infertile, and that myth is not true either, at all. Those are probably the 2 biggest myths that I've heard. We have our work cut out for us to dispel those myths, because when we do have increased supply made available to us, we don't want to miss a step. We don't want to miss a beat. We want to be able to hit the ground running And I take it personally when someone is eligible for the vaccine, has an opportunity to get it, and doesn't because they perhaps haven't had all the information made available to them. I want to make sure people have an opportunity to ask questions and feel empowered to make their own decision, but to do it based on facts and based on science. To that end, we're standing up right now a vaccine community engagement council that will have groups, a healthcare subgroup, a public sector subgroup, a faith-based subgroup, and a community subgroup that we hope can get a little bit more on ground level with these type of issues. I know members of the chamber are participating in those subgroups. There is certainly the opportunity for more people to participate in those if they have interest. Our goal from now for the next few weeks until our supply increases is to try and broker community-based conversations to let people understand facts about the vaccine, have a forum for people to have their questions answered, and hopefully dispel these myths and build vaccine confidence ahead of increased supply. We will get a point where we have large events where you'll see big vaccine fairs in cities across the state. We're just not there yet because of supply, but we'll get there. We got to make sure that when we do, we don't miss our opportunity, and everyone that is eligible for the vaccine has an opportunity to build their own confidence so that they don't miss that chance to get it. I do want to thank everyone. I know members of the council have been very helpful already in both in pushing the COVID mitigation measures and helping communities defend themselves, protect against COVID, and also laying the groundwork for these community engagement campaigns. So I really do thank everyone for that. And Myra, I'll turn it back over to you, but certainly happy to answer any questions if there are any.
Thank you, Dr. Cantor. Yes, as expected, we do have some questions, but thank you. I want to personally thank you for your leadership. It's been really wonderful to have you leading this effort throughout the state and listening to your updates on a weekly basis and sometimes more on a daily basis with through meetings. But I have several questions here for you. For example, when will we have some tests, and what is the status of medication for treatment? That's one. Oh, when will we have home tests, and what is the status of medication for treatment?
Great questions. Home tests are coming. There's been 2 home-based tests, COVID tests that have been approved by the FDA or authorized, I should say, by the FDA. They're kind of in the process of being commercialized now. I don't know what their price point's going to be. The big new factor in them is that they don't require a physician's prescription, which makes it more applicable for a home-based test. So those are coming. I don't know exactly when they're going to hit the market, but I think they'll be a good step. The caveat here, and I have to say this, is testing helps. Testing is a good mitigating strategy, but it's far from 100%. It's far from 100%. And if someone is relying only on testing to protect them, protect their family and those around them, they're making a mistake. And just to give an example of this, I'll take you back a couple months to when President Trump was still in office, and he nominated Amy Coney Barrett to the Supreme Court, and they had a big event on the lawn before her nomination. And they tested every single person at that event that morning. And they still had enough transmission to essentially make a super spreader event out of that forum. So it doesn't take much more than 1 or 2 cases to sneak through. Testing is important. It's just not protective. For medications, this is an interesting part. We now have some good medications that we did not have before for people who are a little bit sick with COVID, but not sick enough to be hospitalized. And what we were is, once you get hospitalized, we had some medicines, particularly steroids and remdesivir, to help with that a little bit. What we were lacking was something to take when you just begin to develop symptoms to try and keep you out of the hospital. That's what we have now. It's called monoclonal antibodies. It is, there's 2 different products out there. One is made by a company called Regeneron, and one is made by Eli. Both of them are administered via infusion. So unfortunately, it's not a pill. You can't go get it at a pharmacy. You actually have to go into a healthcare center and get an infusion that takes about an hour through the IV. Most hospitals across the state are offering this. Some of them are doing it in their emergency departments. Some of them have stood up infusion centers, similar to like what a chemotherapy infusion center would look like to do it. Each hospital is scheduling these a little bit differently. So the best advice I can give is if someone in the community was just diagnosed with COVID, for these times of the essence, and they're much more effective the sooner you take them, but how you're going to get connected to them differs region by region. So if you have been diagnosed with COVID and you have mild symptoms and it's early on, it hasn't been a week or two, it's been a couple of days at most, reach out to either your physician or the hospital that you go to. Ask them how to get connected with the monoclonal antibody treatments. They really do make a difference if they're given within the first couple of days of getting symptoms.
Dr. Cantor, and as a follow-up to that treatment, in the Hispanic community particularly, we're getting information from our families in Central America or South America about vitamins, and take zinc and take vitamin D and take these other medications like, I'm sure you've heard that really we haven't seen any proof here in the United States that they're efficient in combating the virus. Do you recommend any preventive measures like those vitamins, et cetera?
I really don't. It's never a bad idea to multiply, but the idea that taking zinc every day is going to prevent from getting COVID, that does not pan out in the data. I wish it did. It would be easy if it did. It just doesn't pan out in the data. I'll tell you, like any virus, when you let your own guard, your own defenses down, you become more vulnerable. So people who aren't getting enough sleep, people who are stressed, they do tend to get a little bit more vulnerable, like any illness. So it's always good advice to just keep your own health up. But there's no magic bullet. I'll tell you, Byron, the closest thing to a magic bullet really is a mask. This virus spreads through the air, and if everyone in the community wore a mask when they were around other people, we would have much less transmission than we do now.
Right. Well, we have another question. Is it true that vaccinated individuals are still transmitters of the virus?
We don't know. We don't know the answer to that question. It's likely that they're not, and there's going to be data that comes out over the next month or two to answer that question. But at the moment, we don't know. We know for sure they're much less likely, 94, 95% less likely to get sick themselves. We don't think they're able to transmit it once they get vaccinated, but we can't say that for sure until more data comes out.
Already had the COVID virus.
Yeah, I think the question got cut off a little bit. What I heard the question is, do people need to get vaccinated if they've already had COVID? And the answer is yes. The answer is yes. We now know that people can get reinfected with COVID. I've actually heard of a couple of people that get infected 3 times with COVID. So that's possible. If someone is acutely ill and currently has COVID, they shouldn't get the vaccine during that time. But once they're over that acute illness, that 10-day illness, they should get the vaccine. Even people that had it before should still get the vaccine.
Wow. Good. I have another listener that is wanting more details on the app that you mentioned. And as a follow-up, is there any other technology that you know besides the COVID defense that is being developed at this time that we should know about?
The COVID Defense app is probably the main one right now, and it's called COVID Defense Louisiana. If you go to either of the app store, the Apple iStore or the Android iStore, it's pretty easy to find. And then you download it. It's really easy to set up. You just kind of opt into a couple menus, and then it's active, and then it just stays in the background on your phone. You don't even know it's there, but it's casting this kind of Bluetooth net within 6 feet of you. And if another phone has the app and they've registered as being positive, then it'll ping your phone anonymously, and you'll find out later that night. Really easy to use. Again, it's voluntary. No one's forced to do it, but it's completely confidential and completely free as well.
And completely free. Wonderful. Any tool that we can have to alert us to the virus is a wonderful progress and step forward. I have here a question regarding the timeline again, because I know there's been a little confusion of right now. It's been, the healthcare and first line of defense and 70 and above. But do you have a little more definite guideline of when will the 65 and above, 60, or any other groups close pods or that will be accessing the vaccine in the near future?
I wish I had a specific date to give you. I just don't, but I'll explain why. Just now, we think we're going to get more than 1 week's notice of what vaccine we're getting in the future. Up until now, as the governor said, we had no idea what we would be getting from Operation Warp Speed more than a few days in advance. Now we think we'll get 2 or 3 weeks notice, which will help us. The X factor is how many people who are currently eligible are wanting to go get the vaccine. And we don't want to extend eligibility while there's still long wait lines, because that's just going to create some panic. And we know there's a lot of people currently eligible, particularly people who are 70 years of age and older, who are still trying to get it. I'm still on a wait list, and we don't want to box them out, so to say. I think we'll get to 65 and older relatively soon. 2 or 3 weeks is a ballpark. I think we'll get there soon. For the other phases, for people who are frontline workers, I would say ballpark 1 to 2 months, but that really is guessing at this point.
Wonderful. Thank you, Dr. Cantor. And I have a last question here for you. Is the vaccination a one-time event, or will this be required annually like the flu shot?
That's a great question. I should have answered that. So even before that, the 2 vaccines we have now are 2-dose series. You take 1 dose, and then depending on the type, you come back either 21 or 28 days later for the second dose. There's another vaccine down the pipeline. We should have it in a month or 2. It's called the Johnson & Johnson vaccine. That'll be a single-dose series. That'll be nice. It's possible. It's possible that we might need to get booster shots of this, every year or every 2 years. We don't know. And the reason we don't know is because the vaccine just hasn't been around long enough. And the only way to know that is to have people get vaccinated and then see what happens 6 or 10 months down the road. If we start seeing people, 12 months later, if their antibodies decrease after the vaccine and they become susceptible again to COVID, we might need to get a booster shot. We get a booster shot for tetanus every 10 years. We get a booster shot for other things as well. What Dr. Fauci has said, and it makes sense to me, is listen, if we find out we have to get a booster shot every couple of years, you know what? That's better than being in the pandemic. Maybe we will, maybe we won't, but still, that's a better alternative than what we're living through right now.
Absolutely. Thank you, Dr. Cantor. Thank you for your time. And as you know, you can always reach out to us with any updates regarding the vaccines or any information we can share with the community. Thank you very much for joining us today and your great insight.
Thank you, Myra.
And now it's my pleasure to introduce our board member, Ms. Teresa Lawrence, who will introduce our next speaker.
Thank you, Maida. Thank you. Good morning. If you're a small business owner, this is a well-known gentleman in our community. He needs no introduction. He is our very own District Director of the United States Small Businesses. Mr. Michael Ricks joined the Small Business Administration after serving 4 years in Alabama as the Director of Small Businesses. He then came to Louisiana in 2008. Prior to joining the SBA, Mr. Ricks served in the U.S. Army as infantry officer, a program manager for advanced technology and production readiness project for the United States Marine Corps in Washington, D.C., and as a defense acquisition officer in early program conception development for the Army Infantry Center at Fort Benning, Georgia. As an active duty and reserved infantry officer, Michael completed numerous overseas combat and hazardous duty deployments. He was medically retired from active service and is a lifetime member of the Disabled American Veterans Group. Michael is a former small business entrepreneur himself and operated a consulting firm in Florida which advised on software development, business processes, and information systems technology. Michael earned a bachelor's degree in technology from the University of Houston. He also holds a graduate degree in systems engineering from the Naval Postgraduate School in Monterey, California, as well as an MBA from Troy University in Alabama. And to top that all, he is an originally made New Orleans citizen. Him and his family still reside here in Louisiana. Good morning, Michael.
Thank you so much. I apologize. I lost my connection. I had to log off for a second, so I didn't get a chance to listen to my introduction. Thank you so much, Teresa, for your kind words. I appreciate that. And special thanks again to Myra for inviting me to this event, and also Governor Edwards and Dr. Cantor. I enjoyed listening to them as well. And Governor Edwards and I go back 32 years. We actually met for the first time when we were both brand new second lieutenants in the Army at Fort Benning at the Infantry Officer Basic Course, and then Ranger School together. And I've known him for decades now, and he is a remarkable individual. And we are so very fortunate and lucky to having him lead us through this crisis. And that's really what we're at right now. And as part of my introduction, it's almost impossible for me to participate in any kind of call or webinar without first mentioning COVID and the COVID crisis that we're in right now. And I think it's very appropriate, first of all, to have the governor and then, Dr. Cantor before me, because, we have to get control of the pandemic. If we don't do that, then anything that we do to try and help our small business community or the economy as a whole is going to be for naught. So thank you so much to both those gentlemen and their leadership and helping us work through this crisis. So thanks again. So 2020 in review, and I'm very cognizant of my short period of time I have, and I'm sure there's tons of questions, and I just want to offer right now. If we want to do another webinar focused only on answering specific questions about SBA programs and services for COVID relief, and also the series of hurricanes that Governor Edwards so correctly indicated dramatically impacted the state of Louisiana above any other state in the United States. I'm happy to do that. So, but today's presentation is going to be very general, kind of give you a broad brush stroke over what's going on right now on not only existing programs that we have, but also those programs which are still pending policy review. So, the COVID relief package passed early last year. The first, contained, three key provisions in it that the Small Business Administration would be able to programs could directly assist small businesses. And one, of course, was the PPP loan program. And as the governor mentioned, we're very successful. Our community banks and lenders in the state of Louisiana who participated in that program was phenomenal, without a shadow of a doubt. And for those of you on the call that might not be aware of, how the sausage was made, so to speak, behind the scenes, what's going on with our lending community and the Small Business Administration, what we asked them to do was extremely difficult. Under normal circumstances, when we have a new program that was created, there's a comment period, and it's usually handled by the Office of Advocacy, where we collect comments from the community. And it's a process that takes oftentimes up to 6 months. So we don't develop policy until we get comments from the field. But what we did with this program and all the programs, the economic injury advance, the economic injury disaster loan, paycheck protection program, the debt relief program that we had as well, under normal circumstances, you wouldn't be able to see anything like that at a minimum of 3 months. And in reality, what we had was 1 month. And we got the policy guidance on all those programs literally 6 hours before we opened the portal and started accepting applications. So it was a struggle, and our lending community really stepped up. And every time somebody says comments to me, Mike, your PPP numbers in the state of Louisiana was phenomenal. I mean, what did you do? And I can't really take credit for much of that. It's mostly the lending community being patient, taking us on, trusting us when we said that things were going to work out, operating in the dark, and just making loans. So the result was, at the end of the day, we actually had about between 18 and 19% higher PPP loan numbers than any other state of our size. And when the portal first opened, we were actually making more PPP loans than the state of Texas and the state of New York combined. So, and again, that's our lenders, not me. So I just want to take the time to recognize our community banks that really helped us through this crisis, and are continuing to do so with this next round of PPP funding that I'll talk about in a little while. So the other change to the program, of course, was the forgivable advance to the economic injury disaster loan. So not only did we have the economic injury disaster loan, but we also put in, after it was in place, and we went through several iterations of applications while we worked through our technical issues, we actually were able to provide an advance. And like many of COVID, the policy had not been fully developed. So it was a moving target. It was changing every week. We had to make adjustments and changes mid-stride. And I think myself, Joe Lawrence, which I think many of you know is the deputy for the district office, and several members of my staff spent many hours on webinars and trying to assist small businesses over the last 9 months as this program evolved to where it is now, which is reasonably stable. It's not perfect, but we've got it to a point now where I think any of the changes that we're going to be making with this next round will be it'll be less chaotic, and that's been proving out. So that's great. Debt relief, a lot of the problems that we had with not only debt relief, but also debt relief was a program that the SBA launched with the CARES Act back in March, where a person who already had an existing SBA loan could get principal and interest paid for a period of months, depending upon eligibility. And all indications were that that's been very successful and really helped a lot of small businesses navigate that first 6 months, if you will, of the government shutdown, or not government shutdown, but the economy shutdown caused by quarantining. The economic injury disaster loan, of course, that's been very helpful as well. The participation rate for small businesses in that program in Louisiana is much higher than other states of the same size. I think most of that has to do not so much with me or anyone with the SBA. It's just regrettably the state of Louisiana is very competent and capable of navigating disaster loan programs because, as the governor pointed out, especially last year, we seem to have a big target painted on our back. So it's familiarity with the program and the willingness of people to use it that's been a factor in that as well. The second draw that we're having, so I'm going to kind of get into a little bit about where we're at right now with I'm calling it the second draw, but in reality it's the third draw. So it's a Paycheck Protection Program, PPP version 3.0. So we had the CARES Act, then we had the Flexibility Act, and the program went through major changes under both those circumstances. So what we have right now with the third version of PPP is that borrowers who may have gotten a PPP loan in the past and can get another 8 weeks of expense and payroll relief through this program going forward. So I'm very happy about that. Right now, it appears to be fully funded. I think a lot of questions that I get from potential borrowers is the money going to run out? Well, of course it could, but right now it doesn't look like we're in any major risk of this program being exhausted. So I would encourage everyone who would like to take advantage of this program to go ahead and do so. Having said that, there are some problems. Now, the biggest problem, of course, is if you're applying for a second Paycheck Protection Loan program, you may not be going through the same bank that you went through before. So there's data out there. So there has to be a reconciliation against a loan that you may have taken in the past against one going forward. We launched the original PPP loan program with a, very, I'm not going to say haphazardly. Really, it was a function of the crisis, and we needed to get this program out quickly. So a lot of the fiduciary and risk abatement steps that you would normally take with a new program, we just didn't do. We took a lot of risks, and as a result, there's been a great deal of fraud. So with this next round of funding, there have been some safeguards put in place to try and mitigate fraudulent applications for this loan program. That has caused some problems with the application portal, and this has mostly been communication between the lending community and our office, and of course the Office of Capital Access, with problems of submitting applications and getting them approved on time. Applicants that would otherwise be eligible being rejected for a series of error codes that, quite frankly, we in the district office don't have access to. So frequently we'll get calls about, I got this error code, what does it mean? Well, to be honest, we don't know. Now, I don't want you to think that that's there is a plan in place for lenders. So when lenders get a issue, we're going to call them issue, we're not going to call them rejection, get an issue with an application that was sent in. The lenders do have a process where they can submit reapply or submit for reconsideration. And these issues are being rectified on a case-by-case basis. Now, a lot of these error codes are it's a function of glitches that are in the application system that we put in place. We have been assured by the Office of Capital Access that a lot of these glitches will be fixed today. So going forward, so the message I want to put out to the community is, if you've had issues getting that second PPP loan approved by your lender, is to have them resubmit it again, and hopefully a lot of the problems we're having with this next round of funding will be resolved today with some changes to the application system. So thank you for letting me say that. Another question that we get a lot is the latest relief package includes a provision where if you got an advance, an economic injury disaster loan advance, that advance amount was deducted from your PPP loan forgiveness. And this caused a lot of problems. And I really don't want to go into it right now, but what would happen was a borrower would submit a request for forgiveness, and then the SBA would say, well, they got an advance, and so we're going to delete that from the forgiveness request amount. So, if you had 5 employees and you got a PPP loan for, say, $100,000 to cover an 8-week pay period, then the advance would have been $5,000, and that would have been deducted. Now, what we had situations where borrowers, knowing that going forward, automatically deducted that PPP loan amount request based on the advance that they had gotten, and we were summarily taking even more money away from them. So that was one problem. Another problem, of course, was that it was happening, and people didn't know. And so when their forgiveness was not fully recognized, they were still carrying loans. Granted, it's a 1% loan over a 2 or 5 year period, depending upon when you got it. but still, they didn't want to carry another loan, and certainly the lenders didn't want to do that either. It's not a loan that they were actually making money off of. So that's another misnomer I think I'd like to sort of dispel right now, is that somehow this loan program was a major boon to our lenders. And while they did collect origination fees, these are not loans that they're making a whole lot of money off of. This is something that they did in the interest of servicing their customers. So, but still, carrying a 1% loan going forward, was not, it was something that was costing lenders a lot of money. So anyway, the latest version of this loan program eliminated the requirement to pay off your PPP loan with the advance that you've received. So, question. So good, yay, you're going to get some more money. All right, so how's that going to work? Well, you're going to be notified by the SBA at some point, I don't know when, that your PPP loan forgiveness amount had been deducted based on an advance that you may have received. And that information will contain instructions on what you need to do to get that resolved. So if you still have a note going forward, then that'll be used to pay off the loan that you're carrying forward with your lender, your PPP loan that you're carrying forward with your lender. We're still working on guidance on exactly what is going to happen with a borrower who may have paid that loan off already. So they're still entitled to the advance. So how is that going to work? How are we going to make sure that happens? So be advised. Keep a look out for your. It's going to come to you from the email address of the Office of Disaster Assistance, notifying you that this money is coming back to you. So again, I can't give any more information than that. But there's been some confusion about, is the borrower going to be notified or is the lender going to be notified? Okay, I can tell you right now, it's the borrower that will be notified. So if you had a PPP loan and your advance was deducted from that forgiveness amount, expect that will be reimbursed. And if you haven't gotten any emails, when I get some more information, I'll send it out to Myra and Teresa. Hopefully, we can get the information out to Hispanic Chamber members on what you need to do to make sure that that's happened. But I would just right now, I'm begging your patience to wait for that email. But if you don't hear anything back from the Small Business Administration over the next 30 days, I would recommend that you reach out to the Office of Disaster Assistance, and I will provide the contact information to Myra and Teresa after this call so that you can do that. So that's a question that we get quite a bit. The other new program that is going to be available to small business owners is the shuttered venue grant, and that is something it has a potential of being very helpful to a lot of small business venues in the city of New Orleans specifically, but also the state of Louisiana. We still don't have the policy guidance on that. And so and again, I want to reiterate that normally these kinds of things take several months to get done. But we understand that this is a crisis and we need to get this resolved as quickly as possible. Hopefully this will be expedited in a quicker manner, but we haven't gotten any information from headquarters as to when we can expect this to happen. But we do get a lot of questions from business owners about, well, they understand that the provision of the shuttered grant program states that you can't have both a PPP loan and a shuttered venue grant program. We're still working how that's going to pan out, exactly how that's going to work. We still don't know yet, but they're reluctant to take a PPP loan because they're hopeful that this grant program, when it comes available, they'll be eligible for it and they can take that. I'm not in the habit of giving people advice on how they should make these kinds of decisions. These are decisions that I think that the small business owner has to weigh against themselves. But let me just point out a couple of things about the venue grant program. I do get a lot of calls from restaurants or bars that have live music. as an example, and they're hopeful that the shuttered venue grant program will be available to, because who doesn't want a grant? You know, when they can, if the option is a loan. I mean, I certainly understand that, but understand that the provisions of that grant program are that it's at least 70% of your revenue has to be generated from ticket sales. So, something like a movie theater, you would think, oh well, they sell tickets, and and that's how they make money, and so they should be eligible. But a movie theater makes a great deal of money on concessions. So they've got to take a look at where their revenue flow was. Is 70% of my income coming from the sale of tickets? The entertainment aspect of it. If the answer is yes, then of course you're going to be eligible. If not, you really need to consider just going ahead and applying for a second PPP loan. It's not going to be something that's, again, I don't believe that we're in any danger of running out of money, but it would be tragic, if you waited for that venue grant and then found out you were not eligible, and PPP ran out of money. So just to do an analysis. My advice to any small business out there is to take a look at your business. Does the business have 70% of your revenue from entertainment sales? And if that's the case, then please go ahead and wait on that grant, because it's likely to be a little bit better, if not significantly better, than any PPP loan program that you might have. So like I said before, I've been getting a lot of calls from restaurants and bars that do have live entertainment, but many of those, the cover charge, if you will, the entertainment charge, is less than 50% of the money that they make from food and beverage sales. So before you make that decision, take a look at your business and find out if indeed your revenue is mostly from entertainment. Then of course I would recommend you wait. But that's something that you should consider. Lastly, the last thing I'd like to talk about is the targeted economic injury disaster loan increase. We're still waiting on the policy guidance for that as well. But I do have some information that I can put out right now. Now, the provisions of the law, and again, until the policy's in place, I'm not going to be able to comment specifically what actions are going to be taken. I will tell you what we have been told and what you should expect when that program is available. Now, let me be clear. The economic injury disaster loan advance is no longer funded. So it's not going to be available to anyone going forward. So if you did not apply for an economic injury disaster loan in the past, and you did not have and you're applying for one now or applied for one after those provisions expired, you're not going to be able to apply for the forgivable advance now. It's done. However, the changes in the law will allow those borrowers that had been approved for an advance previously, but because money ran out, did not get their money. Well, then this program will allow you to get that original amount that you were eligible for going forward. How you're going to find out that is happening is you will be notified by the Office of Disaster Assistance that is coming. The other provision in the new law would allow a certain targeted businesses and what's being described in the law as underserved will be eligible for up to the full amount of the advance, which was $10,000. So let me give you an example. Say you have 3 employees, you applied for an economic injury disaster loan based on the policy at the time, you would have gotten a $3,000 advance forgivable, right off the top. The law allowed for the advance of up to $10,000. So if you happen to be one of these businesses that's in a designated underserved market or area, to be clear, it's area, not market. But again, until the policy's set, I won't know for sure exactly what that means. You will be eligible to apply for the full amount. All right, so So what does that mean? All right, you as a small business owner, what do I have to do to get this? All right, well, really at this point, nothing. They are going to use GIS data, I assume. They're going to have some metrics that are out there that will determine based on their policy as to what an underserved area is. And you will be notified by the Office of Disaster Assistance that you are eligible for that increase if you want it. And of course, I can't imagine why anybody wouldn't want it, but you do have the opportunity to decline it if you will. So there's really nothing you can do right now. Again, I'm going to repeat myself. I'm begging your patience on this. How this is going to be worked out, is being developed right now, and what's holding it up at this point is number one, what is the underserved area criteria? Yeah, we don't know yet. So once we know what that is, then we'll be able to start identifying those economic injury disaster loans that we've made based on the address that was provided in the application. And we'll be able to figure out where those businesses are and then make sure that that money gets to them. So I did leave 5 minutes. I think I did pretty good. I'm surprised. I thought I was going to go over, but Mara, if anyone has any questions, I'm happy to entertain those right now. Or Teresa, I'm sorry.
No, that's great, Rick. Michael, that was phenomenal information you just shared with us. And I think that moving forward, I think it would be a great idea to follow up with another presentation. But in the meantime, we have a couple of questions for you. And the first question is, how can the SBA help us implement various subcontracting opportunities, mentor or protege programs that the federal government has developed here in Louisiana? In other words, who can they reach out to be a part of this programs that you offer as mentor and protege for subcontractors?
Right. Mentor protege requests and applications can be processed through our district office. I would recommend anyone who's interested in doing that, go ahead and email me, and I'll make sure it gets to the correct staff member. We do process mentor protege. We do have a program. Teresa, I'm sure you're aware. Of course, under the Section 8A program, we had mentor protege. It's been in existence for years. But in the last few years, we've also had what we call the All Small Mentor Protege Program. So it's available to any small business that's interested in doing contracting with the federal government to mitigate some of their capacity issues, bidding on contracts by partnering with a larger firm that might have those capacity, might be able to mitigate some of those, limitations that would prevent you from participating. Just send me an email. It's really easy. It's Michael, Michael, .ricks, RICKS, at sba.gov. That's michael.ricks at sba.gov. And I'll make sure it gets to the correct staff member. Of course, you could always contact Ms. Jo Lawrence. She's the expert on this, literally. She gets called in from national headquarters frequently to teach classes to the rest of the Small Business Administration. And if you don't have her email address, it's jo.lawrence 3 at sba.gov. And you can reach out directly to her, or better yet, go to our website, sba.gov. Go to the state of Louisiana, and my entire staff directory is online, and you can reach out to us at any time, and we'll help you with that request.
Thank you, Michael. I have one more question for you. This viewer would like to know, how can the SBA help us bring a small, specialized business investment companies here to Louisiana? I think it's the acronym is SBIC.
SBIC, right. We actually have only 2 that are active in the state of Louisiana. You can find their information on our website, of course. Jefferson Capital Partners and then Longview Capital. They're both active in the program, and you can look them up. They do They do small business investing. We at the SBA in the district office, I'm just going to be bluntly honest here, we don't have access to their investment information, not in the district office. That's handled by the Office of Innovation and Investment up in headquarters. And they keep the specifics of those investments private for a lot of really good reasons. So I'm not saying that we're, holding this information just to be difficult. But, we do have some liability concerns, and, investors, we get very sensitive about the information that's being put out there. So I don't know exactly what they're doing. I can't say that Longview or Jefferson Capital Partners are investing in ABC type businesses and give you advice on where to go. But it's a voluntary program. An investment group has to want to participate in the program. We have since I've been here in the district office since 2008, we have been very active in trying to recruit small business and investment groups to participate in that program. And for many reasons, there's been a reluctance. And any investor group, it's kind of an ongoing effort that we've had, and I understand the frustration of the community, but there really isn't anything that we at the SBA can do to compel investment groups from participating in that program. But I think it's a very good program. I think it's very successful in other states. But here, there just doesn't seem to be the appetite with investment groups. But we'll keep doing that. And thank you for that comment. And just reminds me that I need to continue doing this. Not to let that get on the back burner and have us completely forget about that effort.
Thank you so much, Michael, for joining us. And now, Mayra.
Thank you. Thank you. And now we've prepared a small video for you as a summary of our very active 2020 and what we have in store for 2021. So enjoy. And with that, we're closing our first signature event of the year. We thank you very much for your participation and joining us today. I think we've had great information from our leaders in the community that are driving and helping us get through this pandemic and crisis. The future is bright. Let's just hang in together and continue working. The Hispanic Chamber of Commerce will be diligently working to help our community any way we can. Thank you very much and have a great rest of your day.
Juntos podemos.